now I'll show you how to check general examinations, how to check. So at first, vitals. I'll show you how to check 4 vitals: temperature, blood pressure, respiratory rate, and pulse. Okay. So for temperature, you can just do like this. Temperature. You can compare his temperature is raised or not compared to your body's temperature. So like this, you can do temperature. Right? Then respiratory rate. So respiratory rate, patient should be properly exposed to check his respiratory rate, to see his chest expansion. It is very important. Okay. He's well clothed here. So for your patient, you need to expose him properly so that you can see his chest movement. So you can count his respiratory rate by standing here. So you can see. So respiration is equal to 1 inspiration and 1 expiration. This is respiration, right? So respiratory rate, you can count, you can see his chest movement. So you can see expiration, inspiration, expiration. So 1 inspiration, 1 expiration is equal to 1 respiration, right? So you can count that. You can use a watch here. So 30 seconds you can count. So if it is like 8, 10, then multiply that by 2, then it will be total 18 or 20 breaths per minute. This is respiratory rate. Am I clear? Yes. So, but if you want, you can do by this way as well. You can sit here. You can keep your eye at the same level of the patient's chest. So if you do like this way, then chest movement will be, you can see more correctly the movement here. So inspiration, expiration, inspiration, expiration. So this is the respiratory rate. So you can count, then you can multiply. If you do by 30 seconds, then you can multiply that by 2. Then it will be total respiratory rate of the patient. Okay, everyone? So temperature, respiratory rate, then pulse, and blood pressure. So blood pressure, you know how to check blood pressure, right? So blood pressure, we'll use a cuff here. Patient will use a cuff here. Then we'll check the blood pressure. But better to check blood pressure in sitting position. Understand? Patient will be relaxed. Patient will be in sitting position in chair. Then you can check blood pressure. But for checking blood pressure, you will tie a cuff here. You will inflate the cuff. So then when it will start beating, it is systolic pressure. When it will disappear, this is diastolic pressure. So how much you will inflate the cuff? We can know how much we will inflate the cuff. So at first, if you try to find the artery here, you know there is an artery. This is brachial artery, right? So at first, you have to find out the brachial artery. So this is a muscle. This is called biceps muscle, right? So biceps muscle terminus, there is a tendon. This is called tendon of biceps. So medial to the biceps tendon, you will find the artery here. If you don't find the tendon, you can taut his hand. You can place your hand here. You can ask the patient to push on your hand. So he will push, then you can find the tendon more correctly. Yeah. So when you will find the tendon, then just medially you will find the brachial arterial pulse. So suppose you have tied the cuff here, then you will feel the brachial pulse. You will inflate the cuff. When this brachial pulse will disappear, suppose his brachial pulse disappear at 120, then you will inflate the cuff more 15 to 20 millimeter of mercury, like 140 or 145. You understand? Then you will release your hand, this hand. Then you will use the stethoscope, the normal way. You will release the cuff and you will try to hear the beat. When it will start beating, this is systolic. When it will disappear, this is diastolic. Am I clear? So we can do normally without checking the pulse. But if you do exactly when the pulse will disappear, brachial pulse disappear, then if you can measure the pulse, then it will be more accurate and you can understand how much you will inflate the cuff. Normally patient is having hypertension, like suppose 200 millimeter of mercury. So then you can understand, yeah, I need to increase the cuff up to 220 or 250. You understand? So by this way you can know exactly how much you will inflate the cuff. So systolic blood pressure, when it will start beating, this is systolic. When it will disappear, this is diastolic. So what is blood pressure? Suppose this is a blood vessel, right? Blood is flowing here. Okay. So this is blood and this is blood vessel wall. So when blood flows through the vessel, it produces lateral pressure on the vessel wall. So this is the blood pressure. So if I tell you about the definition of blood pressure, it will be blood pressure is the lateral pressure that is exerted by blood when it goes or it flows through the vessel wall. So this is the blood pressure. So normal blood pressure, we know normal blood pressure, if exactly we say this is 120/80 in some books, but if you can say in range, it will be like 110 to 130 or 60 to 90. So it depends, it varies from books to books, different books, but this is like normal range of blood pressure. So if it is more than normal, this is called hypertension, high blood pressure. If it is less than normal, this is hypotension. There are many reasons of hypertension, hypotension, right?